Hello and good day. My name is Joe Poor, and I am an RN BSN in Council Bluffs, Iowa. I am also a National American University student enrolled in the Masters of Nursing program with an emphasis in administration. The purpose of this video today is to propose my capstone project. So let's get started. Accurate patient information, whether at shift change or when transferring care from one provider to another, is pertinent. This exchange allows caregivers the opportunity to talk to each other and clarify any concerns. Bedside exchange also allows patients to be a part of their own care. Augmentation of the work can also be achieved because prioritization of care can also be determined. Transferring care from one provider to another can have many issues. It's been suggested that 70% of all sentinel events are related because of a communication breakdown. The use of a standardized tool such as the Situation Background Assessment and Recommendation (SBAR) tool may help providers accurately relay information to each other and allow the patient and the patient's family members to be a part of their care and ask questions. As stated earlier, the purpose of this paper is to propose my capstone project. The problem identified is the relationship between incomplete or incorrect information provided when transferring caregivers and reported patient care incidents related to communication. The proposed topic is relationship between the SBAR tool and how it relates to patient care incidences. This paper will discuss bedside handoff reporting using the SBAR tool at one study site for its consistency and its overall use. The idea is to gather data about the SBAR tool during bedside shift report or caregiver takeover to see how often it's being used and what information is being relayed. Did you know that since 2006, the Joint Commission has required facilities to meet patient safety benchmarks in order to maintain or get initial accreditation? Effective communication of patients' health status and at the change of care is a critical element and influences provisions of care. According to some studies, the complexity of patients, the hospital environment, and the lack of consistency using standardized reporting tools and the lack of the nurse's understanding all are variables that can negatively affect patient care. A literature review was completed and will be presented. The focus of this literature review was to look at the effectiveness of communication in change of shift reporting. Literature review. The purpose of this literature review was to review and examine existing information regarding the effectiveness of communication in relationship to handoff reporting processes and tools. The search was conducted using the Elton Bryson Stevens Company EBSCO host in the National American University online library. Keywords to find these studies included report, communication, failure, bedside, and handoff. Journal articles were limited to full-text articles between 2008 and 2018. Case Study 1. Hawley and Poltek in 2014 conducted a review using existing literature. The purpose of this article was to determine the dynamics of knowledge transferred during shift reporting in acute care hospitals. Studies reviewed were conducted between 1988 and 2012. Inclusion criteria was limited to searches from the Medline and the Cumulative Index of Nursing and Allied Health Literature. The sample size was initially 125 studies. Based on independent reviews, 29 of these studies were selected for review. Hawley and Poltek suggested that the sample size included approximately 800 nursing handoffs and 300 interviews. The method used for this study was a qualitative assessment review. The results showed handoffs are complex with a lot of variability in both the information shared and the information used. It was recommended after this study that shift reporting may be optimized by using consistent guidelines. Case Study 2. Sanjeklin and Sherman in 2014 conducted a study for the purpose of quantifying quantitative outcomes and using a change of shift protocol. This study uses a blended form of nursing reporting that included the use of recorded report and bedside report. The sample study was conducted on 7 medical surgical units in a large university hospital. The study design and methods were quasi-experimental, pre-implementation, and post-implementation. Outcomes measured included satisfaction of both patients and staff, prevalence of falls, overtime for staff, and medication errors. The results suggested that there was an increase in nurses' perceptions of patient safety and the nurses' accountability for patient safety. Patient falls decreased significantly post-implementation of bedside reporting, but it was also found that the report was not always implemented consistently. Medication errors had to be withdrawn from the study after it was conducted due to a variable that invalidated the results. The nurses perceived the new reporting protocol as that it would increase over time, but the review of actual hours showed no increase in overtime. The final post-implementation outcome revealed an increase in nurse and patient satisfaction if bedside report was implemented properly. This study also recommended a blended type of handoff to include patient report at either a face-to-face or a recorded handoff. The study found that patient privacy might be compromised, which is why they do a recorded report or have report done outside the patient room. Case Study 3. Liketa et al. In 2013 conducted a study at the University of Pittsburgh's Pediatric Intensive Care Unit for the purpose of improving communication, which was to improve the patient safety. The overall goal of the studies were to standardize consistent rounds by nursing staff, promote communication among all staff, and ensure shared decision-making by staff, patient, family, and members of other care providers, as well as staff to present ideas and lead presentations on patient care. The sample size included 20 nurses and physicians that were monitored collaborating on patient care issues, describing patient events, and reporting discrepancies in patient orders. Outcomes of the study included a 19% increase in nurses' perception in reporting patient care events and a 57% increase in orders that were discrepancies. This is actually a good thing because they were caught earlier. This study recommended that further studies be done to find better relationships between patient care outcomes regarding patient safety and participation in nursing rounds. Case Study 4. McCaffrey et al. In 2010 conducted a program study for both nurses and medical residents in hopes of improving both communication and collaboration among nurses and other staff. The purpose of this study was to develop, evaluate, and implement an experimental and educational program based on communication and collaboration. The study sample size was a 450-bed hospital with 65 nurses and 50 physicians and residents that were interviewed about what information needed to be conducted during patient rounds and handoffs. The results suggested nurses and physicians only agreed on what information was important 17% of the time. 53% of the time, the information was partially agreed to on what needed to be done, and 30% of the time found that there was no agreement on what information was important enough to be relayed during patient handoff. The outcomes indicated that the SBAR tool may not be sufficient enough to conduct a handoff unless communication barriers were removed and nurses could agree on what information was pertinent. This study also made the recommendations that nurses and other healthcare providers may need more communication training in school and during orientation to help effectively promote patient handoff. Case Study 5. Triplett and Scheibler in 2010 conducted a study to find a reporting tool to conduct a systematic method for bedside reporting that is accurate and concise to the needs of the patient. The study site was Regions Hospital in St. Paul, Minnesota. The study sample size was an over 3,000 root cause analysis from the variance reporting system there between 1995 and 2005. The quality committee, a part of this study, developed a standardized reporting checklist. 69 nurses working in 2 of the 4 critical areas of the hospital volunteered to be trained to use the standardized reporting tool. At the 30 and 60-day mark, staff surveys were conducted to determine the participants' thoughts and concerns regarding the reporting tool. Outcomes revealed that 55% of nurses found medication errors during bedside report before they were given. Also, 43.9% of nurses felt more confident about conducting report after using the tool, while 48.5% felt more confident after report about caring for their own patients. This caused the results to show that while some nurses would have to change their practice, utilizing a standardized tool for bedside report was beneficial for decreasing errors and increasing patient safety. This study also recommended the use of a standardized tool that would be helpful in patient handoff, especially when discussing medications. It should also be reported that this study found that medication errors decreased immediately by 39% as a result of using this checklist. So, all 5 studies that were done for this review found that a consistent standardized reporting tool worked well with improving bedside reporting. 4 of the 5 studies found that collaboration, communication, along with job satisfaction increased with the use of a standardized bedside reporting tool. It also should be noted that McCaffrey et al. Emphasized communication and job satisfaction were new standards added to accreditation evaluations, such as magnet status and as part of the Joint Commission survey. There was one survey that indicated it may not matter what kind of communication tool was used if staff did not understand the basic components of handoff and have good communication skills. McCaffrey and al. Also recommended that emphasizing the basic components of handoff and communication in nursing programs would be beneficial in order to improve patient safety and handoff report. The IRB overview. An institutional review board, IRB, is composed of members from many disciplines that oversee a study or research, including human participants. IRBs have the right and authority to modify, approve, or disapprove research activity. The function of the IRB is to make sure research studies are being conducted properly with minimal risk to participants when conducted for the benefit of the study. The IRB decision to allow, modify, or deny research based on criteria has a lot of power to control studies. In turn, their decisions have a lot of implications over the participants of various studies. The studies being conducted for this paper does not require an IRB because there are no human participants being subjected to any reportable research. Research will be conducted with patients in the room, but patients will not be part of the project. There will be no identifiable patient information recorded during this study. Validity in research is vital to have accurate outcomes. The kind of data used to validate research is how it is collected, and how it is collected is important to those outcomes. Methods. The site for this project is Murtu Medical Center located in Harlan, Iowa. Murtu Medical Center is a 25-bed critical access hospital. Murtu Medical Center offers 2 surgical suites, a 3-bed intensive care unit, a 10-bed mental health department, and a 12-bed medical surgical unit with a 2-bed pediatric ward. Murtu Medical Center offers 20 different specialties in both surgical and non-surgical areas. Murtu Medical Center staff utilize handoff tools that are not consistent and are not standardized. The preceptor for this capstone project requested data be gathered to determine how the situation assessment the SBAR tool that is currently being used at the project site. The researcher will collect this data as the main component of the project. Data collection. Secondary data will be reviewed. This existing secondary data is located in Murtu Medical Center's variance reporting system. The purpose of this review is to identify trends and discrepancies in communication breakdown throughout the hospital that were related to patient care issues. Existing data will be captured from 2013 to 2017. This data was extracted and limited to communication type incidences to gain perspective on the amount of communication incidences that have occurred. Primary data will be generated by observing bedside reporting as nurses, both registered nurses and licensed practical nurses, use the SBAR tool that will be shown. A standardized SBAR tool will be used. The purpose of using the primary data and secondary data is to help clearly define measurable variables to link nursing care to patient outcomes. It is suggested that observation and document review can help understand specific data about the concept of communication breakdown. The data will be analyzed and presented to members of the Murtu Medical Center's administration team, the Quality Improvement Department, nurse managers, and high-performing nurses so the hospital can make revisions to their bedside reporting tools. When the SBAR tool keyword or phrase is not used or not applicable, it will be documented on the observation tool that I have created. Patients will not participate in this project, but they will be available in the room and present during bedside reporting. The amount of time handoff report takes will also be measured. The review of existing data will be assigned numerical values, therefore generating quantitative data. It is also suggested that quantitative data leads to more acceptance in the early stages of implementation, and quantitative data is better used when implementing or evaluating new protocols. The SBAR tool will be used as a guide to the bedside report. SBAR was originally introduced by the Navy in 2002 as a means of relaying information to nurses in critical care units. The SBAR tool has been used for nurse-to-nurse, physician-to-nurse, and other interdisciplinary departments as a means of communicating patient information. The Joint Commission has formally endorsed the use of SBAR as an effective tool in communication. A survey by means of SurveyMonkey will be distributed after the data has been generated so that nurses that use the SBAR tool for the data reporting system can understand what really happened. The purpose of the survey is to gather the nurses' perspectives of the effectiveness of using the SBAR tool, including time efficiency. It is suggested that questionnaires as a means of identifying nurse perception and timeliness of handoff is good to measure how effective the handoff would be. I'm hoping that this capstone project can help Murtu Medical Center implement new protocols for a standardized bedside report with the data that will be generated for this project. I'd like to thank you for your time in listening to this capstone proposal. Thank you for your time.